Congratulations on the birth of your baby. We want you to go home with your baby with the knowledge of what is normal for you and your baby so you can feel empowered to make your own decisions at home. This video has been created by staff at University Hospital Coventry in Warwickshire for families who have recently had a baby with us. The video will provide you with relevant information about what to expect in the first few days and weeks after giving birth. It will also provide an insight to normal changes for you and your baby and information on any concerning changes and what actions we would advise you to take. Before you are discharged home from hospital, you will be provided with your baby's red book. This is for you to take home and keep. Please ensure that the midwife gives this to you before you leave. It contains important information such as baby's weight and immunisation, and will be used by various healthcare professionals during your baby's first 5 years. Please do keep this safe. If you've been prescribed medications, these will be given to you before you leave hospital. If there is a delay and the medications are not ready, you can return to collect these. We will contact you to inform you when the medications are ready. Someone can collect these for you if you wish. Please ensure you take your medications as prescribed on the box and ask if you have any questions. A midwife will visit you on the following day that you have been discharged from hospital. This is called your primary visit, and we will visit between the hours of 9 a.m. and 6 p.m. On day 5, you will receive another visit where your baby will be weighed and we will complete the newborn blood spot screening test to screen your baby for different diseases. Please place a pair of socks on your baby's feet on the morning to ensure your baby's feet are warm. Following this appointment, you will be given a discharge appointment for you and your baby. This will carry out a postnatal discharge clinic at your local family hub. You and your baby will both need to attend this appointment. If there are any concerns found during your visits at home, then the midwife can come and see you and your baby at home more often. Once you have been discharged from the community midwife, the health visitor will then contact you and visit you at home. She will be able to give you advice on feeding, immunisations, health and baby's development. If they have not contacted you, then please call your GP surgery. When you go home, you will need to make an appointment to register your baby's birth. You have 42 days to register the birth. You must make this appointment by yourself. If you are not married and you wish for the father to be on the birth certificate, he must be present at the appointment. To make an appointment, you can either do this online or you can contact Coventry Birth Registration on 02476 833 141 or Rugby Birth Registration on 0300 555 0255. It is common to feel low and teary as your hormones rebalance and your life changes. Sometimes you can have less time for yourself and find the simplest of tasks, such as having a shower, difficult. Low mood at around day 3 postnatally is known as the baby blues. Please make sure you talk to someone close who you trust and seek help if your mood is not improving after day 10. Your partner's mental health is also important too, as they are influenced by birth experiences. If either of you need help, please speak to the community midwife or your GP. Perineal pain and discomfort are very common in the first few days. You may experience bruising and have a cut, also known as an episiotomy, or a tear from the delivery of your baby. Tears can occur in the perineum, the labia, that's the lips of the vagina, and inside the vagina, and the size of the tear may also vary. A first-degree tear is a superficial tear to the skin of the perineum. A second-degree tear is a deeper tear affecting both of the skin and the perineal muscle. A third-degree tear, these are less common, involving the muscles around the rectum and in the case of a fourth-degree tear, the rectum itself. The healing process begins within a week, so if you have any concerns, please speak to your community midwife. Do increase your water intake. Drink plenty of water to help dilute your urine to stop the stinging. Analgesia. It is safe to take regular paracetamol. Please follow the dosage and the frequency instructions. Stitches can take up to 6 weeks to fully heal. The majority of these stitches are dissolvable. Paracetamol and ibuprofen are the recommended pain relief after having a baby because they do not pass through to breast milk and so are safe taken if you are breastfeeding. If you are unable to take these or they are not strong enough, please let your midwife or GP know. Painkillers with codeine can cause constipation, so you may wish to try and avoid these as constipation is common after having a baby. Sometimes it can take up to 3 days before your bowel starts to regulate again, but with increasing fluids and fibre in your diet, this can be avoided. This may be something you are not thinking about right now, but it is important to consider your actions. There are many different types. You must find out which best suits you. Your GP will discuss with you about contraception at your 6 to 8 week check. Contraception choices are available to you immediately after birth. At any time after the birth of your baby, if you have no medical risks, you may use a contraceptive implant, a contraceptive injection, the progesterone-only pill, male condoms, female condoms. It is important after having your baby to do your pelvic floor exercises, as these muscles have been stretched and strained during the pregnancy and childbirth. These muscles help you to stay continent. You should aim to do these exercises as often as possible. Do not worry, they are quick and easy to do. How do you do them? First, squeeze your muscles like you need to hold your urine in or to stop yourself from passing wind. Then hold for 10 seconds and release. Try to repeat this 10 times and make it a habit, such as when you make yourself a drink or feed your baby. The more you do, the stronger your pelvic floor will become. A caesarean section is major abdominal surgery and it takes 6 weeks to recover. Take regular pain relief appropriately and do not lift anything heavier than your baby for 6 weeks. Check with your car insurance firm when it is safe to drive again, as you may not be insured to drive, even if you feel well enough. Your caesarean wound dressing stays on for 48 hours and is removed on the 2nd day after your caesarean. You are more than likely to be at home at this time, so we advise that you remove this in the shower to help relieve the discomfort of taking the dressing off. If you do not wish to remove this yourself, your community midwife will remove this for you when she comes out to see you at home. If you have a PICO dressing, this will be removed by a community midwife on day 7 at home. If no one attends, please can you contact us on the Coventry Community Midwife number. It is very important you stay up to date with your smear test. You should receive a letter with an appointment from your GP from the age of 25, and tests are performed every 3 years. If you have missed this test due to being pregnant, please inform your GP. If you have had high blood pressure, diabetes, growth problems, obstetric cholestasis, or a 3rd-degree tear, speak to your midwife or doctor about the plan of care and safe timings of future pregnancies. When to contact a health professional. Headaches, visual disturbances, rapid breathing, leg pain or swelling, offensive smelling discharge, temperature, concerns over your wound, higher than anticipated pain relief, red or sore lumpy breasts, a fast pulse, epigastric pain, a rash, or a sore throat. A varied diet is essential, full of whole grain fresh vegetables and fibre to aid regular bowel movements. A diet high in iron can also help to reduce tiredness. Vitamin C with meals and supplements helps to increase iron absorption, and beverage containing tannin, tea, inhibit iron absorption, so please avoid. High iron food sources are red meat, liver, watercress, pulses, beans and fortified cereals. plenty of water to drink. If you are breastfeeding, consider taking vitamin D supplements. If your baby is only having breast milk, you should give them daily vitamin D supplements. As a parent, you will soon get to learn what's normal and what is not normal for your baby. A parent knows their baby best. The following are a few unwell symptoms you should be aware of. Changes in behaviour, very sleepy and unable to wake easy. Develop of a high-pitched cry, very pale and blue skin, very red skin, passing pale or chalky stools, developing a rash that does not disappear when pressure is applied. Please contact your community midwife GP or call 111. In an emergency, dial 999. Babies sneeze or sound snuffly because they are nose breathers. They can sometimes bring up clear fluid from their mouth in the first 24 hours or so. If your baby is finding it difficult to breathe, or if breathing is fast or has a wheezy noise, please ring 999. It is a legal requirement in the UK for your baby to be in a car seat when travelling, even if you do not own a car and take taxis. Never buy a second-hand car seat. Once the car seat has been involved in an accident, it will need to be replaced. A baby should not be in a car seat longer than 2 hours. If you are going on a long drive, make sure you stop for regular breaks and remove baby from the seat. Do not leave your baby's coat or snowsuit on whilst in the car. Make sure the chest straps are snug. You should not be able to get more than 2 fingers under the baby's shoulder straps. If using a travel system, it is advised not to leave baby in the car seat whilst out walking or shopping. Some parents choose to share a bed with their baby and some fall asleep with their baby during the night whilst they are feeding. It is important to consider the following. Keep your baby away from pillows. Make sure your baby cannot fall out of the bed or become trapped between the mattress and the wall. Make sure the bedding cannot cover your baby's face or head. And do not leave your baby alone in the bed, as even a very young baby can wriggle into a dangerous position. It is not safe to bed share in the early months if your baby was born small or prematurely. Do not sleep with your baby when you or your partner have been drinking alcohol or taking drugs that may cause drowsiness. Do not sleep with your baby if you or your partner is a smoker. Do not put yourself in a position where you could doze off with your baby on a sofa or an armchair, and keep baby's room temperature between 16 to 20 degrees Celsius. Please refer to the Lullaby Trust on safe sleeping for further information. Safe sleeping advice. Place your baby down to sleep on their backs, never on their front or side. Feet to the bottom of the cot. The cot should be in your room for the first 6 months of age. The mattress should be firm and flat. Soft beds and bean bags are dangerous and should not be used. Do not use a second-hand mattress. Your baby should not be overdressed or have blankets near to his or her face. The room where the baby sleeps should be a smoke-free area. Sudden infant death syndrome, SIDS. Sudden infant death syndrome is the sudden and unexpected death of a baby when no cause is found. We do not know why SIDS is caused, but for many babies it's likely that a combination of factors affect them at a vulnerable stage of their development, which leads them to dying suddenly and unexpectedly. However, we do know you can significantly reduce the chance of SIDS occurring by following the safe sleeping advice. Smoking. It's never too late to quit smoking. There is a free support advice to help you quit. Please speak to your community midwife or GP. It is extremely important not to let anyone smoke around or near your baby. It is illegal to smoke in cars when a baby or child is present. Smoking in the home can also increase the risk of sudden infant death syndrome and health complications. If you do smoke, make sure this is done outside, never in the home. Wash your hands thoroughly and change clothing to minimise your baby from inhaling the smoke on your top. Do not breathe over or hold the baby for 20 minutes if possible following a cigarette. Mother's vaccinations. NHS England and the World Health Organisation recommend all pregnant women to be vaccinated against coronavirus at any stage in your pregnancy and after. You are at higher risk of getting seriously ill from COVID-19 if you're pregnant. If you get COVID-19 late in your pregnancy, your baby could also be at risk. The COVID-19 vaccines does not contain any live viruses and cannot give you or your baby COVID-19. Flu vaccines at any stage in your pregnancy during flu season, October to March. Whooping cough vaccine from week 16 of your pregnancy. Breastfeeding. Exclusive breastfeeding gives your baby all the nutrients they will need. Helps to protect from infection and diseases. Maternal benefits, including protection from diseases later on in life, such as ovarian cancer and osteoporosis. Breastfeeding helps mothers to build a stronger, loving bond with their baby. Breast milk can stay at room temperature for up to 4 hours. The constituents of milk change over time according to the needs of the baby. Feeding support is available in the hospital and community. Responsive feeding. Responsive feeding is responding to your baby's cues as well as your own desire to feed your baby. Feeding responsively recognises that feeds are not just for nutrition but also for love, comfort and reassurance. Breastfeeding can be for as long or as short as a baby needs and vary throughout the day and night. The key to understanding responsive feeding is it ultimately makes both feeding and early parenting easier. Feeding becomes the first and usually the most successful action when responding to baby's needs. It is important to be aware breastfed babies cannot be overfed or spoiled by too much feeding. Vomiting. Small posits of milky vomit after a feed is normal and can be prevented by burping halfway through a feed and at the end. When babies don't settle. There may be times when your baby remains unsettled after a feed. Placing your baby's skin-to-skin contact with you may settle them. Your partner can also help to do this. If you are breastfeeding, you can offer your breast again, even if your baby has just fed. Babies often find sucking comforting and there is no risk of overfeeding a breastfeeding baby. If you have a particularly disturbed night, try to take time out to rest during the daytime. Visitors can wait. Partners can help the mother in the early stages by making sure the mother is comfortable before breastfeeding. Bringing her drinks and snacks. Breastfeeding can make the mother very thirsty. Give plenty of support. Breastfeeding is important for your baby's health. Wet and dirty nappies. In the first few days, the baby will pass meconium, which is a thick, black, tar-like appearance stool. After day 2 to 3, the stool will start to change colour to a greenish brown, then to yellow with seeds at day 5. The frequency and colour will depend on how your baby feeds and on your diet when breastfeeding. Breast milk is more easily absorbed by the baby and is a natural laxative. Please let your midwife know if your baby has not passed meconium by day 2 after delivery. If your baby's poo is ever red or white, please ring 111. Wet nappies. Babies can urinate at different volumes and frequencies. As a guide, a baby who is 1 day old should have 1 wet nappy in 24 hours, and so on as the days go by. Most nappies on the market today have an indicator to show you when your baby has urinated. In the first few days of life, you may notice a pink or orange colour crystal in the nappy. This is known as urates. These crystals develop because baby's urine is concentrated until they start drinking more milk. Red in the nappy is a false menstruation or pseudo-menstruation and is harmless. It is a very light bleed from the vagina in some baby girls. It comes from the effects of your own hormones on her system and it soon stops. Baby care. The umbilical cord. The cord usually falls off by itself around day 5. As it shrivels, it can ooze a jelly-like substance. If it becomes very red, inflamed or bleeds, please show your community midwife. Eyes. If your baby's eyes become watery or sticky, they can be cleaned using pre-boiled cold water. Use a separate cotton wool ball for each eye. If this persists, please see your GP. Skin. Your baby can develop newborn rashes all over the body. It might appear in one area one day, then disappear and reappear in a different area. This is normal. Blue spots. Some babies can be born with a blue spot-like mottled skin, which is usually located on the back or the sacrum, but it can appear anywhere on the body. If noted during the NIPE examination, it will be documented. They are totally harmless and pigmentation begins to fade during the first 2 years of life and usually resolves by early childhood. If your baby appears blue around the mouth and to the lips or has a rash that does not fade when pressure is added, please bring your child to A&E or call 999. Neonatal jaundice. Jaundice is caused by the buildup of bilirubin in the blood. Bilirubin is a yellow substance produced when red blood cells which carry oxygen around the body are broken down. Jaundice is common in the newborn baby because babies have a high number of red blood cells in their blood, which are broken down and replaced frequently. Also, a newborn baby's liver is not fully developed, so it's less effective at removing the bilirubin from the blood. By the time the baby is about 2 weeks old, their liver is more effective at processing bilirubin, so jaundice often corrects itself by this age without causing any harm. Jaundice in newborn babies is common and often harmless. Your baby will have a yellow appearance to the skin and white of their eyes. Yellowing of the skin can be more difficult to see in brown or black skin. It might be easier to see on the palms of the hands or the soles of the feet. The symptoms of newborn jaundice usually develops 2 days after the birth and tend to get better without treatment by the time the baby is about 2 weeks old. Your baby will be examined for the first 72 hours to note if jaundice is present. If you are monitoring your baby's jaundice at home, it is important to contact your midwife straight away if your baby's symptoms quickly get worse or they become very reluctant to feed or hard to wake. If at any time after you've gone home you need to see your GP in relation to any baby concerns, the GP will see your baby under your name until the baby has been registered there. Thank you, and if you have any questions before you leave, please speak to your midwife.